Great to see everyone together. It's great to be back at EASL and actually beginning to see more and more people face to face instead of always through a video screen, and see a number of close colleagues I've worked with over the years, and really excited to meet a number of new colleagues that are all committed to hepatitis C elimination, which is what we're here to talk about today. I'm Dr. John Ward. I'm the director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health in the United States, and with my colleague Lindsay Hebert here. It's my pleasure to convene this policy forum to examine our progress toward hepatitis C elimination in Europe. What are some of the issues around health equity for the populations at highest risk for hepatitis C, but maybe the most difficult to reach for a variety of reasons, and what's the recent armed conflict in Ukraine? How has that posed a new population that we need to be concerned about? I'm going to be introducing my co-moderator here in a moment, and you're going to see we have a very rich group of speakers to talk about their experiences in Ukraine, Moldova, Romania, Poland, Lithuania, and Georgia. And then we'll have a great panel discussion to give a broader context of how this means more broadly in Europe and globally. Next slide. Just to, I call it a little mental calisthenics to give us, we get focused on, what special moment we are upon when we think about hepatitis C elimination. Not every disease, is positioned as hepatitis C is to be eliminated. And it really it started in many ways with the discovery of hepatitis C virus in 1989, or when it was first reported by these three gentlemen here that were awarded the Nobel Prize in Medicine and Physiology in 2020 for their collective work that led to that discovery, which made the reliable tests we have now possible and the curative treatments that we have now possible, as well as improving the epidemiology for us to really identify the risk factors for hepatitis C, as well as the natural history of hepatitis C. And I'm very proud that Dr. Harvey Alter is a member of the Coalition Executive Board, and we work very closely with him because he recognizes the special moment that we're in, whereby it's our opportunity to turn this Nobel Prize level research into practice so that people all around the world can benefit from this scientific discovery. Next slide. At the Task Force for Global Health, I started the coalition about 4 years ago with Lindsay and some other colleagues that are here with me. I moved over after 13 years of directing the Division of Viral Hepatitis at the US CDC, where I was responsible for a variety of research, surveillance, and policy development. I got involved globally, working with WHO and with some of the countries you'll be hearing about today, as well as working with a variety of partners in industry to develop public-private partnerships that expand our work. And one of those was AbbVie, and I'm very appreciative of AbbVie being a supporter of the coalition and of this policy forum. But we seek to do our work in three ways. We want to build a community of practice by bringing people together to share their lessons learned and experiences. So that's why we're convening this policy forum. Secondly, strengthen the evidence base for hepatitis C by sharing those lessons learned. You're going to hear some very novel strategies today that I think that can be applied globally. We provide direct technical assistance ourselves and do some operational research. And then thirdly, we know that hepatitis C is an underappreciated, underrecognized disease. People don't really recognize the special moment at hand, and we want to do our part to increase that awareness and bring more partners to the table so that we can build the capacity needed to achieve hepatitis elimination goals. Next slide. And we really focus on helping programs get started and be successful. And when you look at the history of disease elimination programs, which I've gotten to be more familiar with because the task force operates and manages a number of global disease elimination programs, you realize all of them have these essential components. They have good information, they have a national plan, they have policies to go with that plan, they have a community understanding and buy-in of the program, they have political commitment, the government's involved, they are beginning to implement strategies appropriate for their health system, and then they have a financial plan so that all that work can be supported. And then they have data all along the way to help them improve their program and help them understand when their goals have been achieved. Now, the other key element of this is health equity. Really, the ultimate goal of disease elimination is health equity, because how otherwise can you eliminate a disease if you're leaving parts of your communities out of your effort? And so it's really part and parcel of disease elimination is health equity, and that's what we're focused on today. Next slide. Now, we work with partners in countries to help them come together and collectively, civil society, clinicians, national governments, to help them understand what is the status of their planning, policy development, implementing prevention, testing, treatment, and how well is that's going, what's their achievements, what's their challenges, and work together to understand feasible next steps. So you can really develop that local coalition that can work together to solve those problems. We've developed about 30 of these profiles. They're available on our website at globalhep.org. Georgia is an example in the room today that has developed a profile. We're working. Ukraine will be releasing one here very shortly, and we look forward to working with all the countries represented today in developing these profiles. Next slide, please. So that's our example of building local coalitions. We also have been working at the regional level, sort of as we are here in Europe, to get this community of practice strengthened and helping countries, programs share those lessons learned, learn from each other, and realize that they're part of a larger effort than that their day-to-day experience may suggest. So in Asia, we had with the Asian Liver Association meeting, we brought together a policy forum similar to this with a call to action of what was needed in those countries and in Asia more broadly. We helped convene the North American Hepatitis Elimination Summit, which included Canada and Mexico to do a similar sharing of information and calling for improvements. And then just several weeks ago in Africa, we convened about 12 African countries and Africa CDC, WHO, others to have this type of presentations and discussions that we're going to be having here this afternoon. And I think it all shows that there's real leadership in many, many countries, and there's really a number of positive efforts underway, and progress is being made toward elimination. And it's a good, for me, it's a good reminder that we have to be persistent and maintain our passion, even though the challenges can be large. If we stick with it, progress can be made. And I think you'll see some examples of that surely here today. Next slide. We really wanted to focus on Europe for several reasons. Number one, it has the largest number of HCV infected persons by WHO region. It's high in the number of new infections, high in mortality rates. It has a large number of people who inject drugs with high rates of infection. And then we have inequities that you'll be hearing about today for people who inject drugs, the incarcerated, perhaps geographic barriers such as rural populations and socioeconomic status, their insurance coverage, and then migrants, refugees, internally displaced persons that we wanted to focus on, which has always been an issue, but has been brought into more visibility with the recent Ukraine refugee situation that we'll be hearing about. Next slide. And also, we need to do better collectively. We need the proportion of persons who are HCV infected, who are aware of their infection and being treated, is not yet at the standard that WHO has set to reach the elimination goals. And we have to work to do to reach a key risk population, people who inject drugs in testing and treatment, as well as the prevention services that can prevent transmission among that population. So this just gives you some of the background about why this policy forum is important. So what we'd like to do is go over these various populations in the context of their burden of hepatitis C, look at some of the strategies being employed for prevention, testing, and treatment for those populations within the countries, and then begin to identify some ways forward to overcome the health inequities to eliminate hepatitis C. You know, on our part, we really see this as an opportunity to grow this community of practice, particularly in this particular part of Europe. Develop a call for action that we're going to be going over and agreeing on. At the end of our time together, we're going to come together with a policy statement that will capture our presentations and discussion today. And they're really going to use that to communicate it as widely as possible so we can get more and more partners engaged in our work and supporting our work. And I really greatly appreciate all of you attending today and look forward to your presentations. And please, join in the discussion when we ask for questions and comments, because that's when we can really have a really fully very interesting meeting. Next slide, please. So this is just the agenda. We'll be having some presentations from the countries that you see here, and I'll be obviously we'll be presenting their introductions in more detail in a moment. Next slide, please. And then we'll have a discussion with those presenters, as well as others that you'll be introduced to after our break. And please stay for the full program. I think you'll find it very interesting. At this point, I want like to turn it over to my co-chair, Mr. George Kalamitis, who is the general manager of the Hellenic Liver Patient Association, which is a non-governmental organization in Athens, Greece, and he's current president of the Liver Patients International, which is also located in Athens, Greece, perhaps because you're located in Athens, Greece. Maybe that's the wrong thing. But George, please say a few words to welcome everybody.
Well, thank you very much, Dr. Ward, for the invitation and for this organizing this very interesting meeting. My name is George Kalamitsis. I come from Athens, Greece. And I am the co-chair of ACHIEVE, which is another coalition of umbrella patient organizations from Europe, but also international patient organizations like EATG, European AIDS Treatment Group, World Hepatitis Alliance, European Liver Patient Association, the Correlation Network of Harm Reduction, and IC Global from Barcelona. So there's a few things that I wanted to state with you before we start this meeting, the presentations. I have made a few remarks here. I'm also chair of the Hellenic Liver Patient Association, and I would like to address the crucial topic of achieving equity in our efforts to eliminate viral hepatitis. Despite the progress that has been made, viral hepatitis is far from ending epidemic that is falling short of the 2030 WHO Global Hepatitis Strategy and Global Elimination targets. Impetus is very much needed. While we recognize that the European Union competence in health matters is limited, it is crucial that we acknowledge the role the EU can play in addressing health inequalities among member states. In our fight against viral hepatitis, it is crucial that we pay particular attention to the needs of refugees, migrants, but especially also to other marginalized populations. These individuals often face unique challenges and vulnerabilities, including limited access to healthcare services and social stigmatization. In this fight, the principle of health equity should guide our efforts, ensuring that all individuals, regardless of their socioeconomic status or geographical location, deserve equal access to screening, testing, treatment for viral hepatitis. By supporting this principle, we can make substantial progress towards our shared goal of eliminating viral hepatitis. The United Nations Sustainable Development Goals provide a clear framework to drive our collective efforts in improving health and well-being globally. The EU has committed to help member states in achieving the UN SDGs, including health-related goals and help measuring progress. This commitment must ensure that no one is left behind in our fight for viral hepatitis. Thank you very much for the attention, and I look forward for the upcoming discussion.